Hey everyone, welcome to my channel. Today, we are diving into the fascinating world of blood disorders, conditions that affect millions of people worldwide. But don't worry, I'll break it down in a simple animated way so you can understand the causes, symptoms, and treatments. Let's get started. Blood disorders are conditions that affect the components of our blood, including red blood cells, white blood cells, platelets, or plasma. These disorders can lead to serious health complications, so it's important to recognize them early. Blood disorders can be divided into three major types based on which part of the blood is affected. Anemia, low red blood cell count, causes fatigue and weakness. Sickle cell disease, misshapen red blood cells cause blockages and pain. Polycythemia vera, excess red blood cells make blood thicker, increasing clot risk. Leukemia, uncontrolled growth of white blood cells, leading to blood cancer. Lymphoma, affects lymphocytes, weakening immunity. Neutropenia, low white blood cell count, making infections more dangerous. Hemophilia, blood doesn't clot properly, causing excessive bleeding. Thrombocytopenia, low platelet count increases bleeding risk. Deep vein thrombosis or DVT, blood clots form in deep veins leading to serious complications. Blood disorders have different symptoms, but here are the most common warning signs you shouldn't ignore. Fatigue and weakness, caused by low oxygen supply, often seen in anemia. Frequent infections, due to low white blood cell count, as in leukemia or neutropenia. Excessive bleeding or bruising, a sign of clotting disorders like hemophilia or platelet disorders. Pale or yellow skin, indicates anemia or liver-related issues. Swelling in the legs, could be a sign of blood clots, such as DVT. Chest pain or shortness of breath, a dangerous sign of poor oxygen flow. Blood disorders can be caused by many factors, including genetics, lifestyle, and infections. Genetics, inherited conditions like sickle cell disease and hemophilia. Poor diet, low iron or vitamin B12 can lead to anemia, infections, and viruses. Some blood cancers are linked to infections like Epstein-Barr virus. Medications and toxins. Some drugs or chemicals affect blood production. Chronic diseases, kidney disease, or autoimmune conditions can lead to blood disorders. Doctors use various tests to diagnose blood disorders and find the best treatment. Complete blood count or CBC measures red blood cells, white blood cells, and platelets. Blood smear test examines the shape and size of blood cells. Genetic testing identifies inherited blood disorders. Bone marrow biopsy checks for blood cancers like leukemia. Complete blood count or CBC measures red blood cells, white blood cells, and platelets. A blood smear test examines the shape and size of blood cells. Genetic testing identifies inherited blood disorders. And a bone marrow biopsy checks for blood cancers like leukemia. The treatment for blood disorders depends on the type and severity of the condition. Here are the main options. Medications can include iron or vitamin supplements for anemia, blood thinners for clotting disorders, and chemotherapy for leukemia. Blood transfusions help restore healthy blood cells in severe anemia or cancer. A bone marrow transplant aims to replace damaged blood cells with healthy donor cells. And lifestyle changes like a healthy diet, exercise, and avoiding smoking can prevent complications. Some blood disorders are genetic, but many can be prevented with a healthy lifestyle. Eat a balanced diet rich in iron, B12, and folic acid. Exercise regularly to keep blood circulation strong. Stay hydrated to support blood flow. Avoid smoking and limit alcohol to protect your blood cells. And get regular checkups to detect any issues early. Blood disorders can be serious, but with early detection and proper care, they can be managed. If you experience any symptoms, don't ignore them. Get checked by a doctor. If you found this video helpful, don't forget to like, share, and subscribe for more medical explainers. Got any questions? Drop them in the comments below.